Okay, so let's continue where we left off with the first PowerPoint presentation, and that's the dental caries process. So we have 4 overlapping circles that illustrate the factors involved in the development of dental caries. So all 4 act together, and as shown by the center, dental caries results. So what I want you to see here and what you need to know is that it takes four elements for caries to happen. You need the microorganisms, you need a cariogenic diet or a diet high in carbohydrates and sugars. You need salivary factors. Okay, so we're going to talk a little bit about that, but xerostomia is one example of a salivary factor that we would have here. Okay, and then we need tooth resistance. So think of fluoride. Fluoride helps with this component and builds up that resistance to these other 3 factors. Okay? So it is a balancing act. And as you can see here, decay-causing factors, if they're all high, it's going to be there. But we can also do a bunch of protecting factors and kind of balance it out so that we don't get decay. So we have the bacteria and the sugar. So the microorganisms right here, okay, and sugar, and they together will produce acid. Acid starts to destroy the tooth and decay results. Okay, I'll just draw a little arrow here to the decay. All right. And then this other band of circles, I guess, kind of give you another idea of that, okay? So we have smooth surface decay and we have pit and fissure decay. And you can see in this meth mouth that the decay is along that cervical third, okay? And that is smooth. Oh, sorry, that circle kind of went off a little bit. But that's on the smooth surface of the tooth. Now, pit and fissure decay is kind of, well, you can see there's a little filling right here that goes right on that occlusal surface, okay, into the pits. So then we have erosion, and with erosion, there's no bacteria involved with enamel erosion. That's important to know. However, it can erode the enamel enough and increase the risk of developing caries lesions. So it is a risk factor for dental caries. So what are things that could cause erosion? Think of those really acidic sodas. You think of having gastric reflux, okay? A history of eating disorders, sucking on lemons. All of those can cause erosion. Okay, so here we have our acidic foods and drinks, and they can contain sugar or not contain sugar. So as you can see in this first picture, that is meth mouth. So again, you see it on those smooth surfaces. But people think, oh, diet soda, that's all right. But sometimes the pH level is still low enough where it creates a very acidic diet, and then maybe you're eating something with it with a lot of carbohydrates or a lot of sugars. Okay, and so look at some of these in this picture here. What's hidden inside a bottle of fruit juice? And look at those acidic levels. Okay, so the acidity is in blue and then the sugar's in red. So all of them are very acidic. Okay, milk is our best bet, but it does still have some sugar in it. All right, look at this Coca-Cola. The pH is 2.5. That's cleaning our drains out, right? And then the sugar, 14 grams of sugar, or teaspoons of sugar per pint. So that's a lot. Okay, so here's just a list of different sodas and their acid and their sugar content. So look at how close Pepsi and Coke are to battery acid. Isn't that crazy? I just think this is such a great visual. You might want to put this in your flip chart also that you're making. Okay, so what are some of the effects of diet on biofilm? Well, if you're eating cariogenic foods, which are foods that cause dental caries, the effects of the sucrose on the mouth will increase the pH of the biofilm. So these sugars kind of attach to the biofilm, and then they start releasing or fermenting these acids, okay? And then that's what is helping the enamel break down. Food intake, food particles are not needed for biofilm formation. Okay, so that's always kind of an interesting little tidbit. Then the texture of diet, so mastication only affects the occlusal and incisal thirds, but of course we have a lot of pits and fissures. So if we have a really sticky texture, then it might get stuck in those pits on the occlusal surfaces, causing decay or biofilm buildup. Okay, so periodontal infections, we're going to talk about these a little bit later on, but do know that in health, the bacteria is going to be more anaerobic and gram-positive with really low white blood cells, next to none, okay? And then as the disease progresses, we're going to get more pathogenic bacteria, and it's going to have its own kind of little microbial complex. And don't review these tables. I believe they are from a different book. But major microorganisms implicated in the destruction of periodontal infections, we're going to get into that a little bit later, okay? Periodontal infections, bacteria versus health and disease. We will get into that again more in the future. So subgingival invasive pathogens initiate perio infections that lead to destruction of bone in the supporting tissues of the tooth. Bacteria and toxic products can access the body via diseased periodontal pockets, because again, that tissue is ballooning out, it's stretching, causing it to be more easily penetrated. The connection with systemic diseases and conditions, so far research is finding a strong correlation, not a relationship, but a correlation between arteriosclerotic disease, adverse pregnancy outcomes, diabetes, pulmonary disease, and stroke. So we're definitely going to keep seeing more and more of this research coming forward throughout your career. Okay, let's talk a little bit about Maturia alba. And Maturia alba stands for white material, okay? And it's just this really loose, adherent mass of bacteria. It looks like cottage cheese. And so it's bacteria and cellular debris, so it could be, dead cells in there also. That frequently occurs on top of dental biofilm where the biofilm removal has been neglected. So you're going to see this thick kind of cottage cheese looking Maturia alba once a patient hasn't removed the biofilm frequently. So it is clearly visible without disclosing agent. Again, it looks like cottage cheese. It is a combination of living and dead bacteria, disquamated epithelial cells, disintegrated leukocytes, salivary proteins, and particles of food. The effects of Maturia alba, the surface bacteria in contact with the gingiva contribute to gingival inflammation. So again, it's more bacteria in there. It's going to irritate the tissues, possibly penetrate into the tissues. So it's going to cause more inflammation. Tooth surface demineralization and early non-cavitated lesions are also seen frequently under the Maturia alba. That makes sense, right? Because it adheres to that biofilm that's been there for a few weeks. So it's, again, going to leach out all those minerals out of the tooth. Prevention, this can be removed with a spray of water or an oral irrigator, whereas the dental biofilm can't. So that's how loosely adhered Materia alba is to the tooth. Food debris is loose food particles. They can be found and collect around the cervical third, and the proximal embrasure spaces. Carcinogenic foods can contribute to decay because they do kind of merge in with that bacteria really easily and then just continue to produce more and more bacterial acid. Now, vertical impaction is when there are open contacts in the area. So say two teeth don't come together, or if the teeth are mobile or irregular occlusion happens. Then food might be forced between the teeth during mastication, and this could result in vertical food impaction. I have an area in my mouth every time I talk about that. I can kind of feel it with my tongue, that open contact. And then we have horizontal or lateral food impaction, and this occurs in the facial and lingual embrasures, particularly when the interdental papilla, that papilla that's kind of peeking right between our teeth, are reduced or missing. So when you don't have those, it makes it pretty difficult to keep food out of there. So think of those patients with a lot of recession, okay? And then as far as removing it, this can be removed with a toothbrush and interproximal biofilm removing devices such as Proxibrushes, floss, toothpicks, things such as that. All right, so as a review, after all external material has been removed from tooth surfaces, the acquired pellicle forms when? A, within minutes is the correct answer. Within minutes after all external material has been removed from the tooth surface with an abrasive, such as your polishing cup, right, and polishing paste, the acquired pellicle begins to form. A mineralized dental biofilm is called, and that is D, calculus is the correct answer. Periodontal disease and dental caries are infectious and transmissible diseases caused by pathogenic microorganisms found in microbial biofilms. Biofilm is significant in the formation of dental calculus. Calculus is essentially mineralized dental biofilm. Which of the following is a loosely adherent mass of bacteria and cellular debris and is white or grayish color in appearance? Dental plaque, Materia alba, calculus, or acquired pellicle? And the answer is Materia alba. Anytime you see that word loosely adherent, you're going to think white material, okay? Which of the following is a loosely adherent mass of bacteria and cellular debris and is white or grayish white in appearance? Dental plaque, Materia alba, calculus, or acquired pellicle? Again, Materia alba, and here's a great picture of it. All of the following are considered fermentable carbohydrates except one. Which of the following is not a fermentable carbohydrate? Xylitol, sucrose, fructose, cooked starch, and glucose. And this one should have been an easy one for you after pharmacology. Xylitol. Xylitol is a non-fermentable carbohydrate. It is a salivary sweetener, or artificial sweetener, sorry, used in sugar-free chewing gum, especially our Mentos gum, I believe, has it. Some Mentos gums and the icebreakers are known for it. But also people can go to health food stores to find this. And it actually reduces the level of strep mutans. That's the key, is that it reduces strep mutans and helps promote tooth remineralization. All the other choices are fermentable carbohydrates. Remineralizing tooth surfaces should not be scratched or altered in any way. Which of the following techniques would be the most acceptable way to detect coronal caries on a demineralized surface? Panoramic X-ray, Sharp Explorer, irrigating syringe, curing light, or a blunt probe? You want to use something blunt like a probe, or you could use the side of an Explorer, but you don't want to use that sharp tip of the Explorer because you don't want to cavitate into that. You don't want to break that, that structure that's still holding up on the tooth, because that can be remineralized and the tooth can then be formed, keep its form. An individual can be in the high risk or low risk category for development of dental caries. All of the following factors are low risk factors in the development of dental caries for adults, except one. Which one of the following is the exception, is not low risk? Normal salivary flow, uses xylitol gum, sealants on pits and fissures, poor manual dexterity, and regularly scheduled visits. That should have been an easy one. Poor manual dexterity, right? All the others are going to help keep the teeth nice and solid and free of bacterial biofilm buildup. Okay, I will continue with chapter 16 on the next PowerPoint.